Tetanus is an acute disease manifested by skeletal muscle spasm and autonomic nervous system disturbance. It is caused by a powerful neurotoxin produced by the bacterium Clostridium tetani and is completely preventable by vaccination. It is found throughout the world, and tetanus commonly occurs where the vaccination coverage rate is low. Clostridium tetani is an anaerobic gram-positive, spore-forming rod whose spores are highly resilient and can survive readily in the environment throughout the world. Clostridium tetani produces two exotoxins, tetanolysin and tetanus plasmin. Tetanus plasmin, generally referred to as tetanus toxin, is the neurotoxin that causes the manifestation of disease. Toxin is transported by intraaxonal transport to motor nuclei of the cranial nerve to ventral horns of the spinal cord. Once inside the neuron, the toxin enters a retrograde transport pathway. After reaching the spinal cord and brainstem, tetanus toxin is secreted and enters adjacent inhibitory interneurons, where it blocks neurotransmission by its cleaving action on the membrane proteins involved in neuroexocytosis. The net effect is inactivation of inhibitory neurotransmission that normally modulates anterior horn cells and muscle contraction. This loss of inhibition of anterior horn cells and autonomic neurons results in increased muscle tone, painful spasms, and widespread autonomic instability. Because Clostridium tetani will not grow in healthy tissues, a convergence of factors must be present in order for tetanus toxin to be elaborated in the human host. This combination of factors usually include absence of antibodies plus two or more of the following: a penetrating injury, co-infection with other bacteria, devitalized tissue, a foreign body, or localized ischemia. The incubation period of tetanus is approximately 8 days but ranges from 3 to 21 days. The incubation period is typically shorter in neonatal tetanus than in non-neonatal tetanus. The most common and severe clinical form of tetanus is generalized tetanus. The presenting symptom in more than half of such patients is trismus or lockjaw. Patients with generalized tetanus typically have symptoms of autonomic overactivity that may manifest in the early phases as irritability, restlessness, sweating, and tachycardia. In later phases of illness, profuse sweating, cardiac arrhythmias, labile hypertension or hypotension, and fever are often present. Since patients with tetanus have no impairment of consciousness or awareness, both the tonic contractions and spasms are intensely painful. Tonic and periodic spastic muscular contractions are responsible for most of the classic clinical findings of tetanus, such as stiff neck, opisthetonus, rhizus sardonicus, a board-like rigid abdomen, periods of apnea, or dysphagia.